take you back to the looming health workers' strike on Monday and what necessitated it. What was the genesis of it all? Now, on May 6th this year, as the country was 3 months into the pandemic, the Salaries and Remuneration Commission approved a 3 billion shilling COVID-19 medical emergency allowance and benefits for frontline healthcare workers in the national and the county level. Now, this would see doctors and pharmacists receive 20,000 shillings per month, and clinicians, nurses and lab technicians receive 15,000 shillings. Well, these would be dispersed over the course of 3 months with effect from April the 1st. And there was a delay in the payment of the allowance to county governments that eventually dispersed the funds in July as a 3-month lump sum to health workers. Well, this amount was 2.36 billion shillings, according to the Council of Governors. Now, from August to date, health workers have not received any additional COVID-19 risk allowance beyond the 3-month payment that was cleared by SRC back in May. Now, though the government targeted the perks to last 3 months, the doctors' union wanted the allowance tied to the end of the pandemic that's still ongoing. Well, this, as well as a lack of PPEs and allegations of corruption in their procurement, comprehensive medical care, and the recent deaths of health workers from COVID-19 seemed to push doctors towards embracing a strike. Now, in August, the healthcare unions threatened a nationwide strike and said they planned to stop work on September 10th in protest if their demands were not met. At that time, Kenya's caseload was slightly over 32,000. In November, the Kenya Medical Practitioners, Pharmacists and Doctors Union issued a 21-day strike notice to the government. By this time, 30 healthcare workers, including 10 specialist doctors, had died from COVID-19. Now, on November 18th, KMPDU met the National Assembly Health Committee to address their issues. On November 23rd, the Senate Health Committee met the medical fraternity to understand their issues. Well, this included KMPDU, the Kenya Nurses Union, KUCO, as well as other healthcare worker unions. Now, after the meeting, the Senate demanded to visit KEMSA over PPEs issues and pointed out the counties were ill prepared. 2 days later, on the 25th of November, the National Assembly Health Committee met with KMPDU, the Ministry of Health, SRC, NHIF, and various universities, including Kenyatta University, Moi University, and University of Nairobi. Now, they resolved that recommendations would be achieved in 7 days and others in 14. On December 2nd, the National Assembly held a meeting to review recommendations with the same team, which included KMPDU and the universities, as well as the CEC from Kirinyaga and the Ministry of Health. SRC, Treasury, and the Council of Governors, however, did not honor the invitation. Now, the meeting was adjourned, and the committee asked for 14 more days. KMPDU subsequently refused. The following day, on the 3rd of December, that is the day before yesterday, the Senate Health Committee met KMPDU and requested 7 days to issue summons to NHIF and the Council of Governors. The health workers' unions refused and announced a nationwide strike to start on Monday, December 7th. And there you have it, a chronological look at the doctors' union strike and what necessitated it. On that note,